John, over to you.
Well, thank you very much and welcome everybody. I'd just like to introduce myself briefly. I'm John Nutt. I'm the chair of the Primrose Hill Surgery's Patient Participation Group, or PPG. And I'm also a member of the Community Association's Events Committee. We're calling ourselves the events team nowadays. But we've all been involved in running this series of events this week to mark Mental Health Awareness Week. I'd just like to say a few words about the PPG. If you're a patient at the surgery, you can join our patient group and you'll find a sign-up form on the website under PPG, or you can email us, and I'll put the two addresses in the chat box as we go along. My colleague Tim here is the chair of the events team, and he's going to administer things as we go along and hopefully sort out any technical issues that we have. So welcome, Tim. And we're also recording the event, and we're going to put the video on the Community Association's website in due course for other people to view at their leisure. Now, before I introduce our guests, I'd like to ask participants if they have any questions, or perhaps they want to relate their experiences during COVID, to do so by using the chat box, and we'll pick out those questions as we go along after the initial talk by our eminent professor. Now, I'd like also to give a tribute to Dr. Maria Saar, who I think is with us tonight. Maria has been a stalwart doctor at the surgery since October 2014. And I'm very sorry to say that she's leaving us this month to emigrate with her family to Australia. But Maria, we want to thank you for all that you've done for the surgery and to wish you Godspeed and happy landings and good luck for your new life down under. Maria, I think up to the last few weeks has even been doing some research into phone apps, seeing how people relate to them. And we've been trying to promote the NHS app amongst patients, amongst the myriad of other apps that seem to be there for people to use. So thank you, Maria, and we do wish you all the best for the future. I'd also like to pay tribute to Dr. Paul, the lead clinician at the surgery. You may not know it, but she's been leading up the rollout of the COVID vaccinations at the local hub, which is at the Belsize Priory Medical Centre. And Dr. Paul and doctors from some 9 surgeries and a whole host of volunteers have been doling out the vaccinations. And she's also been overseeing the refurbishment of the surgery premises over the last 2 months. How she does everything, I don't know. But on behalf of all the patients, Abanti, thank you very much for all that you've done and are doing. Now, I'd like you now, please, to introduce our 2 guests this evening. And like I said, if you've got any questions as we go along, please put them in the chat box and we'll pick them up as we go along. Thank you.
Thank you, John, for the introduction and for your kind words. And thank you, everyone, for joining us tonight. It's a shame that we are not having our meeting in the library and it's over Zoom, but we definitely look forward to the next meeting in summer at the library, where we can again be meeting face-to-face. I'd like to thank Dr. Saar. She's been an amazing doctor and a very supportive colleague over the years. She's been in the practice before I joined, and she's going to be missed by everyone. And I'd like to thank all the doctors and all our patients for supporting me with the vaccine campaign. And even our guest speakers, Prof. Bhugra and Dr. Gupta, has been helping us with the vaccine campaign. We have achieved 27,000 vaccines over the last couple of months, and we have covered around 87% are clinically extremely vulnerable patients. So, and our patients have been volunteers helping us as marshals. We've had our practice staff vaccinating. Dr. Shah has been there over the last 2 weekends. So big thank you to everyone. I know we have a very busy agenda for tonight, so I'd now like to introduce our guest speakers. We are very fortunate to have Professor Bhugra and Dr. Susham Gupta to answer all our questions, and Professor Bhugra would be presenting tonight. Professor Bhugra needs no introduction. He is a former president of Royal College of Psychiatrists, former president of International Psychiatric Society, former president of British Medical Association. And we are very lucky that we have an academic psychiatrist along with practicing psychiatrist, Dr. Susham Gupta, who practices in East London Trust. And he specializes in early intervention and prevention of psychosis. And both of them are joining us tonight. Let's introduce them. Hi, Dinesh.
Thank you very much, Avanti, and thank you very much, John, for inviting me. I'm having trouble screen sharing, but I'm sure somebody will sort it out. It's a great pleasure to be here, and particularly in this Mental Health Awareness Week. I mean, certainly the last 15 months or so have been really tremendously stressful for everyone. And that has created a major set of problems for most people. And one of the things that I did want to, I think somebody needs to enable me to do the screen share.
You go at the bottom panel, there's the green bit which says screen share.
Yeah, I'm doing that, and all of the message I'm getting is that host has disabled me.
So you need permission from the host.
Yeah, it's because you came and went, Dinesh, but I have just cleared you again. So
thank you. The joys of modern technology. And and we should be able to see it now.
Yes.
Yeah, we're in.
And let me just expand that. Entirely my fault. So we know the story of SARS-2 COVID-19. Started off with a sort of small news story in Wuhan in November, December 2019. And suddenly the whole world has been enveloped by it. And what's really quite interesting is that, like most things, the focus has been on infection control and not on the impact that infection has on people's mental health and well-being. So over the next 15 minutes or so, I'm going to cover the challenges that we have faced and the lessons we have learned from previous epidemics and pandemics. And you would know we've had the Spanish flu about 100 years ago, and then in this century we've had SARS, we've had Middle Eastern respiratory syndrome, we've had Ebola, we've had Zika from Brazil, and there are a whole host of challenges and lessons from previous epidemics and pandemics. And we're still in the middle of the pandemic. I mean, there's no way we can say that we are over it, no matter what the politicians want us to believe. And it's very, very clear that it will probably take another year or more before things get back to any kind of normalcy. And even though we, as Avanti was saying, and congratulations on 27,000 doses of vaccines, we still need a tremendous amount of immunity within the community. Although the WHO has said that it will take up to 2 years, my own prediction is that probably be longer than that. And there are three challenges for us when we look at coronavirus and mental health. I mean, firstly is the impact on general population for everyone, whether they are infected or not, directly or indirectly. And then there's the impact on people who already have pre-existing psychiatric disorders. And thirdly, the mental health of COVID patients who have recovered. And certainly there are increasing reports about long COVID and about post-traumatic stress disorder and what that means and how that's going to impact upon people. And I remember several years ago, there was a G20 meeting in Australia on looking at the impact of Ebola. And all the 20 leaders who were there were focusing precisely on how to manage and control Ebola. And I was the lone voice at that point trying to scream that you need to look after people's mental health. And part of the challenge, certainly in the West, is that quite often Western medicine makes a distinction between physical health and mental health. And that's a big, big problem because we know that, if you're feeling unwell physically, it affects your mental health and well-being. If you're feeling low and depressed or feeling anxious, it affects your body functioning. So you can't separate those two. But unfortunately, there is a tendency to feel that mind and body are two separate things and they don't talk to each other. So the impact of pandemics and epidemics on mental health can be of 5 different kinds. One is that those who've lost a family member, and certainly in the first lockdown, we've seen horrendous stories where people have died alone and the family has not been able to visit them or grieve properly, not being able to say goodbye. And how do you tend to resolve that grief? Because that gets into depression and creates more problems. And then there is a challenge about survivor guilt, people who have survived. Why did I survive? And why did other people around me died? And what does that mean? And then particularly with lockdown and isolation, and I will come back to that, there are sort of challenges to do with stress, anxiety, depression, feeling trapped. And that sense of entrapment and lack of control is very, very important to understand the impact that pandemics and epidemics have on people's mental health and well-being. And there is also a serious danger for which the medical profession is partly to blame, that we tend to medicalize normal human responses. So you can't feel sad anymore, you have to have depression. You can't feel stressed anymore, you have to have PTSD. So I think there are those challenges that we need to be aware of and we need to take those on board. And then there is the impact on mental health of people who have got a pre-existing physical condition or a pre-existing psychiatric condition. And what does that mean and what does that lead to? So we looked at the pandemic and its impact on mental health, and we felt that there are five stages, just like stages of grief. So when the pandemic started last March, when the WHO announced that there was a pandemic, there was a sense of fear. Everybody got frightened because we didn't know what was going to happen. It was fear of the unknown, feeling scared. And that led to then anxiety and panic. And, you would all remember the bulk buying of toilet rolls, empty shelves in supermarkets, people sort of hoarding things, a sense of panic. And then there was a sense of anger that, we should have been prepared for it. We knew in November that something was happening. Everybody sort of took it fairly lazy attitude. You did not take into account travel plans and people coming in, and why wasn't travel from China stopped? Why wasn't travel from elsewhere, Italy and Spain stopped, etc. So that sense of anger and frustration. And we know that when you kind of take that anger inwards, it turns into depression. And if you take it outwards, it turns into violence. So there was a sense of entrapment, which also leads to and feeds into that sense of depression. And then you reach a kind of acceptance. Okay, we are here. This is what is happening, and this is what we will need to do. And this is what we need to cope with. And we know that in the past epidemics, and as I was saying, that there have been clear lessons from Ebola and Zika and Middle Eastern respiratory syndrome and SARS, that high levels of anxiety and people start to self-medicate. And there is considerable research evidence now coming through that although the pubs had been closed till relatively recently, people were drinking much more. And if you're feeling trapped and you want a break in the day, to break the day, you need to do something different. And quite often it's, a glass of wine or a glass of beer would do. And similarly, the levels of substance misuse have gone up. And then, as I said earlier, that there is a challenge in identifying stress and stress disorder. And there's some suggestion that people who have recovered from COVID are showing high rates of post-traumatic stress disorder, of being trapped in the intensive care unit. And what does that do? And we also know that, people who developed multi-organ failure, but then came out, and what that did, and the whole impact of long COVID, we're still beginning to learn. And then people getting depression either with direct contact or indirect contact. And I've already touched upon survivor guilt. And then there are specific issues for healthcare workers and frontline workers, bus drivers, tube drivers, train drivers, people who are cleaning the streets, people who are on 0-hour contracts and, delivering food and groceries and so on and so forth. So there are specific issues for that. And we know, the stages of the pandemic thus far, we've had, I count this as a third lockdown, and we're just coming out of it. And by no means it's clear that we're not going to have any more. We know that the gradual opening of public places, so there might well be an increase in the numbers and cases as schools have opened, and we still don't understand the levels of infection in schools and in children, and what does that mean? And once cinemas, theaters, stadia, and others open, and we have seen some evidence that the snooker tournament in Sheffield was opened, and all the people going in were tested, and if you were negative, you were allowed to go in, and people were wearing masks. But we still don't know. It's too early to see what the impact of that action would be. And I don't like the term social distancing. I think it's a misnomer. It just kind of gives a very wrong message. What we should be focusing on, physical distancing or personal distancing. This is the time when we need social closeness, not social distancing. And it really annoys me that we've gone down this route where it's about social distancing from each other. We need to be socially, emotionally close. So it's about physical distancing. And these terms do matter. And one of the big challenges and lessons, and we heard the Prime Minister say that there will be an inquiry into the handling of COVID next year. So we will see whether that happens or not. But what's very clear immediately, that there's been a lot of disjointed thinking and a lot of mixed messages, a lot of disjointed practice. And if it wasn't for the NHS, which is a healthcare system, we would have been in much worse shape, as we have seen in America, and they're only now beginning to catch up. We can see the mess in India because it does not have a fully integrated healthcare system. In this country, we would have done much better if there had been a clear links between social care, healthcare, and public health and healthcare. So one of the big challenges, and again, the inquiry may tell us that who made the decisions and what were those decisions, what the impact was. But when we go into lockdown, and there are challenges to do with isolation. You may be staying at home, you may be with your partner, and particularly before schools open, pressures on children, online learning, increased levels of domestic violence, child abuse, physical abuse, emotional abuse. So again, we know there is considerable research evidence that at least 4 adverse childhood experiences, ACEs, if you have 4, then your chances of developing a psychiatric disorder in adulthood is 7 times higher. And we don't know the impact of adverse childhood experiences as a result of the pandemic, particularly in terms of how children have been abused so sexually and emotionally and physically, and what their impact is going to be. And then there is the impact of self-isolation. What does that mean? We know that quite often healthcare workers have been forced to self-isolate because they've come in contact with an individual, and loneliness leading from that. Working from home can be easy, but can also be quite difficult if you don't have access to good quality Wi-Fi. 2 or 3 of you working from the same home in overcrowded accommodation, there are going to be problems. And we've seen the rates of COVID and COVID-related deaths in Black, Asian, minority ethnic groups have created further problems. And working from home, quite often, it also means that it's lack of structure to the day. When you go to the office, you go to the shop, you go to your business, the time you take to travel sort of puts you in a mindset which is good for your work, which is good for your health. Quite often there are distractions when you're working from home. Postman comes, the doorbell goes, there's a delivery, and people know that you're at home. So, you're more likely to get phone calls and so on and so forth. So but it's also limited social contact. And over the last 15 months, over 400,000 papers have been published on COVID. Quite a lot on mental health. These are mostly online surveys. And there's very clear evidence that different sets of research tools have been used, and there's overdiagnosis of anxiety, depression, other conditions such as trauma and PTSD. And again, as I said earlier, that it's about over-medicalization and over-diagnosis. So I would urge a caution in interpreting some of these findings. And we know that long-standing inequalities have caused problems, structural and societal environments and socioeconomic factors. If you're rich, you got access to a garden, you can sit there and work. If you're in a council block, getting out can be problematic. Do you take the lift 9 floors down? You go down the stairs, and there's increased risk of exposure. And I've already touched upon key workers, higher use of public transport, have higher risk, as do multiple occupancy households. And there's also, those are the populations which also have higher rates of long-term conditions, mental ill health, poorer uptake of prevention services. And in addition, there are risk factors like obesity, diabetes, hypertension, etc. And these are the findings from a qualitative study which Public Health England did in October, November last year. So there are key messages here. There's impact of long-standing social and economic inequalities. And I think you as a patient body have a very powerful voice. And I think you need to convey to the powers that be, to the politicians, to the policymakers, to the stakeholders, that this can't go on. And we know that there's increased risk of exposure if you're poor, increased risk of complication, and then there are challenges to do with stigma, discrimination, lack of trust, etc. We were hearing from Dr. Paul that she was doing a lot of consultations online. So what about psychiatric patients? Do we do e-mental health? Do we do telemental health? What are the challenges if you are in a crowded flat? Other members of the family are around you. How safe, how private, how confidential is that consultation? How do we carry out the investigations? For psychiatric patients, there are challenges to do with compulsory detention, violence on wards, refusal to wear masks, isolation, staff infections, etc. And sense of anxiety and panic and lack of PPE, which we've heard quite a lot. And then running staff shortages, and Dr. Gupta will be able to tell us more from his own experience of self-isolation of colleagues, which has meant that his workload has trebled, and that creates problems. So what do we need to do to look after our own mental health? I mean, first and foremost, the message is that mental health is far too important to be left to the specialists. It's everybody's business. We need to look after our own mental health and well-being, and I'm just making a few suggestions. This is not a prescription, but I find that setting a time limit to watch the news rather than having rolling BBC 24 hours a day is not good for your mental health and well-being. Make small decisions daily. Create transition time during the day. Okay, this is my half an hour lunch break. I'm going to take it. This is my tea break, 15 minutes. I'm going to not respond to emails or do things. Designated daily worry time. This is my half an hour to worry. And one thing I learned during various roles was that you get swamped by situations, you get swamped by lots of people demanding lots of things. One worry at a time. Deal with it, then move on to the next, then on to the next. Write or talk about your feelings, share your feelings. If you have nobody you can talk to or share with, keep a diary. Connect to your senses, listen to music. If you're going out for walks, stop and listen to the birds, look at the trees, reach out to friends one-to-one. You're allowed to feel sad, you're allowed to feel anxious, you're allowed to feel stressed. But it is really important to know when to seek help and who do you seek help from. You know more than anyone else what stresses you. But equally importantly, you also know more than anyone else what relaxes you. So if it is meditation, great, take time out. If it is yoga, do that. If it's physical exercise, jogging, doing exercises in the flat or in the back garden or whatever, listening to music, listening to, watching. I watch a lot of old Bollywood films on YouTube. So that's my relaxation. I can watch the same film 8 times. I can watch Poirot and Miss Marple on ITV3 any number of times. It just, by the time I finished watching, I've forgotten who'd done it, so I can watch it again. So you need to find those times which are for you to look after your mental health and well-being. So just to sort of conclude by saying that you're allowed to feel stressed. You know what stresses you. You also know what relaxes you. And please do not seek information from Twitter or Instagram. Quite often, these are very personal values. Seek information from reliable sources, such as the Royal College of Psychiatrists website, Mind website, Mental Health Foundation website, SANE, BMA, other organizations. So do whatever works for you. So I'm really grateful to you all for inviting me. And once again, thanks, John and Avanti for the invitation, and also the technical team to make sure that I could share my slides and happy to take questions, comments, thoughts whenever we wish. Thank you.
You're muted, John. We can't hear you.
Dinesh, thank you so much for that presentation. I think very enlightening to all of us. I must say, on a personal note, I've stopped listening to the news in bed, and I listen to Radio 4 Extra and listen to comedy programs instead. So that's one thing I've done.
I agree.
Does anyone have any questions that they'd like to ask Professor Bhugra? Maybe put your hand up, or
I think I've put everybody to sleep.
No, not at all.
No, Dora has got her hand up. Right.
Well, really just to say, thank you for a really, really good and interesting talk. There were lots of, in fact, I've taken notes on some of it. Particularly liked the idea of not social distancing and personal distancing. I was interested in what you said about PTSD from being in an intensive care unit. I wondered if you could say a bit more about that and how it can be treated.
I think, there are two issues. One is that are we sort of really experiencing PTSD? We have to sort of look at the diagnostic criteria and check how long the symptoms have lasted and what's going on. And quite often, I think these days it's become very fashionable that you can't feel stressed, you have PTSD, because it has sort of more, in some cases, more social cachet. And I have, heard people talk about that, after giving birth to, their child, they had PTSD. Now, that raises some sort of very interesting questions about what's the diagnosis for and what do we do? And if it is PTSD and if it meets all the criteria of flashbacks and not being able to sleep, feeling depressed, bursting into tears, feeling scared, not being able to go out, then you do need, formal treatment, which would be, any number of things from a combination of psychological therapies to medication if need be. So it is, I think there is a recognition, and which is a good thing. But I go back to my earlier point that quite often it's in nobody's favor to make erroneous diagnoses, because I've also come into sort of this theory of labeling, that if you label somebody as having condition A, then they start to behave as if they have condition A. So the challenge for us as clinicians is to tease out, and if patients do get distressed, and you can have all kinds of, different people have different ways of responding to stress and trauma. And one size doesn't fit all, neither in terms of diagnosis or in terms of treatment. So what I'm urging is a note of caution, that we need to be aware. Yes, some people can have that, but not everybody would. So we should not pigeonhole people and say, no, you can't feel stressed. You have PTSD. And if it's diagnosed professionally and, a clinician says that this is it, then there are ways forward that we can deal with it.
Hello.
Hi.
Hello.
Yes, we can hear you. Would you just introduce yourself, please?
Yeah, it's Corrine here. Hello.
Hi.
I just wanted to ask you, I think there's also a problem that, I don't know how to put this, but maybe
you're
it's
among
not,
friends.
Maybe it's not possible to go back to where you were after COVID, because there's the thing of the long-term COVID and things that are possibly taken away from you. that you had previously, mentally or physically or both. And I don't think there's any resources supporting people out there with these kinds of really serious problems. And not even that much information.
No, you're absolutely right. I mean, I think one of the things that we have to bear in mind is that we are still learning about COVID. We've learned to live with it for the last 17 months. We don't know the impact, and we don't know how many variants we would get, what their impact would be on people's health, physical or mental, and what that would mean. And similarly, that there would be implications, long COVID, tiredness for a long time, body's immune system recovering. And I think there are things happening, and there's just a message popped up in the chat that there is a long COVID clinic in UCL. So again, I mean, it's one of those things that we will keep learning, and then there may be other trusts or hospitals or services which will develop those kind of services, something specific for long COVID, something specific for building on immune system, something specific for dealing with depression. So I think it's I mean, one of the big challenges has been the tremendous amount of pressure on healthcare system. And full kudos to the National Health Service that, in spite of everything, it has survived. But the message really is that the 10 years of austerity did not help. So we really need to take politicians to task to make sure that if we are faced with a similar situation, and it will happen again, whether it's in 10 years' time or 20 years' time, it will happen again. So what do we need to do to be prepared for that? So you need both, regular services, and you need specific, specialized, targeted services. So I think that's the challenge for service providers and working with patients, their carers and families to convey the message to the policymakers that you need to take this seriously. This is a important call to respond to. I don't know, Susham, if you wanted to sort of come in and say something.
Yeah, I know what Robin feels to Batman. So
who are you calling Batman? In this context, never mention Batman. Remember, COVID started from bats.
Yeah, I was making a snide comment there. No, I'm just joking, of course. I was just listening to you, and everything that you were saying rings so true. I'm a jobbing clinician, so everything that Dinesh said, I mean, we're facing every day. So our number of referrals have increased. So it was, it's interesting, isn't it? Because the whole society is under attack. Individuals are under attack. Family units are under attack. I mean, everyone's, both isolated as well as disconnected and disintegrating in some way or the other. And it's trying to hold things together. So, and how do people seek help? I mean, it's that fine balance. We want people to be able to say, I'm not feeling well, I need support. Now, and also you want to encourage people to seek help from GPs and the support, healthcare system. But again, there's that what Dinesh was talking about, this risk of overdiagnosis and medicalizing problems, and it's that strange situation where people also feel that what they're struggling with needs validation. So often there's this pressure to diagnose. And if you were saying, it's really tough and many people are struggling, it doesn't necessarily make them feel better. So you can't just say, go away, everyone's struggling. That's not how it's going to work either. So it's that fine balance. But again, what do you do with the when the numbers are so high, I mean, Dinesh was talking about telepsychiatry. Oh, I mean, I sometimes call it kind of Bangalore psychiatry, like sitting in front of the call center and kind of one Zoom, consultation after the other. And by the end of the day, my eyes are about to pop. I'm sure Maria and Benji can tell you about similar experiences. So again, the risk is if we overdiagnose people, then they get into a sick role. And there's expectation of medication, and there's psychology waiting lists are so long. But it's not all doom and gloom, to be honest. It's I think our job to help people understand. And there are lots of new initiatives that are coming up in outside the NHS and helping. It's very important we know what's available, and up to a point help people understand, normalize as much as possible, and then be able to separate the ones who are really struggling. And Dinesh, in your slide, you spoke about the learnings from previous epidemics and endemic. Two things I was a bit surprised was not there was the increased rate of psychosis and suicidality. I don't know whether that's from more prevalent elsewhere, or because we've definitely seen an increase in number of suicides in our suicide and suicidality, especially in the initial bit of the pandemic. And Dinesh, any comments on that?
I think that's sort of two or three things that I'm going to pick up on. I mean, firstly, if we take the point about increasing demand and we're not going to be able to meet it, and I think there are alternatives. There are some fairly decent online programs to manage depression, for example, or manage anxiety. I'm not saying that they're all good, but they are there and they can be accessed. Second thing is that quite often there are local initiatives which can be easily set up as sort of support group meeting once a week. Now that the sort of lockdown has been lifted, so that would help. So you can actually sit down and talk about your stress and form new friends, new links, new social contacts. Thirdly, the challenge about looking at, particularly in primary care, it's really important to know what's available locally. And I think Dora has kind of raised a point about social prescribing, and that may be Primrose Hill Community. I saw on your website that that's one of the options. So working together. Going back to your question about high rates of psychosis and suicidality, I think certainly in the previous epidemics, and I'm thinking more about Ebola and Zika and others, that the rates of suicidality were not that high. I'm not aware of the psychosis shift either. So it'll be really interesting to see. And then, we know that there's something called psychogenic psychosis, which, causes psychosis, which is temporary in relation to, stress and psychological factors. So, but the point that I want to make is that, as I sort of started off by saying, that mental health is too important to be left to specialists. It's everybody's business. And I think we need to be able to sort of work together, whether we go online, whether we learn from Mind or Royal College of Psychiatrists website, or another, or look at online cognitive behavior therapy. There are lots of sort of fairly decent apps which provide that. But equally importantly, I think it's worth bearing in mind that we should not be medicalizing normal human responses, because some way it takes away the responsibility from us as human beings and puts the responsibility and blame on somebody else.
the rate of psychosis definitely, the number of referrals have increased disproportionately. And I think anxiety is when people are very worried and it's quite internal. And at some point, there's always the possibility of it becoming externalized. Anxiety to fear, and often people being stuck indoors. I mean, the number of referrals we've had about people feeling that the neighbors are spying on them, poisoning them, tampering with their computers, and people don't like their neighbors much. That's what I realized from the pandemic. No, I'm just joking. There are also wonderful supportive stories of support. Another thing is, just as much as people have been disconnected, I mostly work with young people. I mean, many people who are working in London, they haven't had contact with seen their family for a year or so, and it's been really difficult for them. And not having, as Dinesh was talking about, the importance of structure. Some of the people who've managed to get a structure in their lives, I mean, routine has been very important as a survival mechanism, and those who've not been able to make that transition have really struggled, because sometimes day and night, everything and these things are very important. Sleep, our fresh air. We're not meant to be in little boxes. And also when we are in little boxes, in our houses, what happens is, when we go out, we can see the tree and noise and a plane fly by. We are distracted in a positive way. If not, we go inside ourselves. And another thing we've noticed was how people have started talking about past trauma. It's almost like being re-traumatized. Things that they're having a structure, a life, that kind of, it's always about, the balance between resilience factors and risk factors. So we all have risk factors, past experiences and current difficulties, but we also have ways of coping. And somehow the resilience factors have been stripped away, and people are often stuck in thinking about this. And some people, and that drives anxiety, and not only that, the threat of COVID and fear of health, people's own health and contamination, worrying about families, but also, it triggers old, ancient pain. And there's a concept called double hit theory. People who've had previous very negative experiences, when faced with adversities much later under stress, it just kind of almost reignites a kind of almost a trauma response. And that can come out in anxiety, depression, suicidality, psychosis, substance use, you name it. So that's what we are seeing now.
Could I ask, Sisham, as you probably know, this year's theme for Mental Awareness Week is nature and the environment. How important do you think access to nature and the environment is in this time?
It's in the care plan of every patient I see. I ask them, how often do you leave your home? Do you have a green space near you? And more than medication, I would say, make sure you go out, spend 30 minutes, just walk, especially if it's a sunny day. It's just that thing about being preoccupied in your own space and feeling stuck and not having control. It's a strange thing. It's that being stuck and not having control is a really potent combination. So even just going out just distracts our mind. And environment plays, and environment is not just physical environments, it's a psychosocial environment. And being bombarded, I know you guys were talking about being bombarded by all this negative news. I have to admit, I've switched myself off from watching the news as often, but I can't help it. But I've got a bit of a public health interest. So I can't help but look at the graphs of the number of infections and deaths almost every day, the first thing in the morning. It's like a morbid preoccupation. I just
you need to see a good psychiatrist.
I just love graphs, it's my slightly autistic trait.
No, that's your artistic brain, you see.
Something that Abanti mentioned to me this morning, which quite shocked me, was she said that patients are now refusing to have the AstraZeneca vaccine. And that's come about through some very dubious statistics, it seems to me. Do you have any comment on that?
I do a bit of work in our East London, which is quite a big hub, and I've spent some time at Abentee's, your hub, and it's a very different model. Ours is very clinical and lots of nurses and doctors in cubicles, and it's like a conveyor belt of people. And I come to Abentee's hub, and it's like buzzy and energetic and smiley people. It's really very different. And so I've enjoyed my time there. Yeah, I think that it's again fear and not being able to, and this is very much the social environment and how fear then gets passed on from. So people can't even make the differentiation between, oh, if you take the vaccine, there's a risk of, say, 2 out of 1 million who might get clotting, and yet if you have COVID, you've got thousands. But to them, oh, I want the Pfizer because it's less than the 2 clots. So again, people have the right to choose, but it's also the problem is people are getting educated from all sources, and because we work in a system, for a long time we have tried to listen to patients, but sometimes it reaches a point of where it doesn't really have. People are actually putting themselves at risk because of lack of knowledge, and it's difficult for people. I think our role is to educate them, and some of them will choose not to have AstraZeneca, unfortunately.
Tusham, I have a question for you. How do you support colleagues, doctors, healthcare professionals, and how do you identify stress or depression in them? I'm sure it's very common now.
I'll tell you the difference of 2 teams. So we have 2 teams in our office. So when the pandemic happened, one team was waiting for the trust board to tell them what to do. Our team said, how are we going to keep ourselves safe? Because if we keep ourselves safe and well, we'll be able to deliver care. So we actually stopped having meetings. Which at that time, we are waiting for the trust, CEO to tell us to stop meetings. I said, no, let's do it in a different way. And actually, by the end of it, only one person had COVID from our team, while the other team, and they continued to have not only COVID, but long COVID and all of that. So I'm not being, I'm trying to, draw from my experience. And it was very important that we have, so every week, every fortnight, we have a 90-minute slot when we ensure, and it's as important as seeing patients, where we meet. And often people cry. We have an external facilitator. People break down, and people have had losses in their own lives, their own struggles. But that holds them. And I have noticed how. And another thing is checking in on each individual, because there's always this risk of 1 or 2 people taking over and getting a hijack. It's really important to go around the room and making sure everybody has their voices are heard. And I think that's been the biggest protective factor.
Thanks, Tusham. But we have also seen a lot of kindness, haven't we, in this period? Like volunteers at the hub, working week after week. You do like 5 days at your clinic, and then you support the vaccine hubs. And we are so well fed at the hub. Every week we have patients baking cakes for us, getting food. Like, I think it's been an incredible experience. Like there's lots of positive things to learn from the pandemic as well.
See, in our hubs, you're not allowed to bring any food because you don't want people putting their feet. I mean, there's a slight different culture, but you know what? I love coming to your hub because of just the energy.
Well, I think it seems that we're running out of questions here.
I would like to ask something, if I may.
And Justin has
Thank you. Well, a question and also something I'd like to share about my experience, but I'm sorry if I'm asking something that's been asked before, as I was just got home, so I'm sorry about that. I just want to say about the vaccine, I absolutely sort of have a strong disliking for conspiracy theories, and I even, avoid people who believe in them like the plague. So I think there's a difference between that and having sort of anxieties about the vaccine. But what I wanted to say is that some of my fears around the vaccine, and I would appreciate hearing something from you about this, is the fact that it's genetically modified, which the NHS themselves admit. Whether it could possibly sort of make your immune system weaker, so you then have to have the vaccine every year, because otherwise you'd be more likely to catch COVID than if you hadn't had the vaccine in the first place, which I've heard. I don't know if there's any truth in that, and also just the unknown factor of what could happen in a few in a few years' time that we just don't know about. So, and the other thing I just wanted to say briefly about my experience, which is not a question to do with the lockdown.
So about the vaccine, I do not think it can weaken the immune system. So it can only stimulate the immune system to produce an immune response, which would protect against COVID-19. And long-term effects, there's constant research and studies being conducted in different populations. And as of now, all the results have been positive. The number of cases of blood clots, thrombosis have been very minimal. And overall, I think we have managed to fight the pandemic, and this is the only way forward at the moment.
And what about GM? I'm saying that because I would avoid, I realize I might eat GM food out without realizing it, but I would avoid food if I knew it was GM. And so what about the risk of having that GM being put in the body?
We are constantly monitoring and doing studies to see what the impact is. As of now, we haven't found any negative impact of the vaccine. Overall, it's been really positive. And I think one of the reasons we have done so well in this country is because we have managed to immunize the vulnerable population very quickly. But it is there's constant research and ongoing, and we will find out with time.
So and just the biology of it, these are small mRNAs like DNA, but it's a genetic material, but they don't replicate. So when it's injected in our body kills it off, and during that process they produce an immune response, and the immune response does not last forever. So it's not that the genetic particles replicate.
So it's not like it could genetically modify our bodies. Whereas GM food, if you're eating it a lot, I imagine it could have that effect. Would you agree?
GM food is different. I mean, they're less nutritive. They are they're greener and nicer to look at in many ways. And the problem is these plants do not reproduce often, and so they're reliant on the seeds. So that's a slightly different thing. So qualitatively, they are probably poorer. So you have a point
nicer
there.
To look at than a vegetable that's not GM? You mean because they're not so natural, is what? Yeah, I understand.
Yeah. So they're genetically modified to look bigger. They're all round and ripe, red and colorful, and nutritious,
which is unnatural.
But they are actually not.
So it's not the same. Yeah.
And also they are resistant to infection, for storage and all of that. So they are nutritionally probably less. Definitely, some of them are very poor. But this is slightly different. These are small kind of protein-like particles, and they are destroyed within 24 to 48 hours.
Thank you.
So and you get an immune response that lasts for a while. And I know, if people are that worried, I mean, the AstraZeneca option is always there, which is a vector. It's again a harmless virus. Very
Oh,
similar
that's
to
the one I
coronavirus.
had, but on the paper from the NHS, it does say that it contains GM.
Yeah, because the Pfizer one, everything. I mean, actually, if this is to be described, everything all kind of vaccines we used are GM, because they are laboratory based, artificially produced. But the question is, do they have a long-term impact on the system, or do they change our DNA in some way? Not really, but we get an immune response, which again has an impact, but that also has a shelf life.
Oh, but it doesn't change your DNA in any other way, is what you're saying?
No, it does not. These particles would not attach to our DNA or RNA. These are simple particles that go into our bloodstream, but our body will kill it off right away.
Yeah, I didn't realize that other vaccines were also GM. I thought it was new with this one. So yeah.
The kind of AstraZeneca is a kind of an old-fashioned vaccine where you have viruses, actual viruses, and the body kills it off. They don't replicate.
More of that. That's what I thought. Yeah. And I was just going to say something about my experience from the pandemic, but I don't have to say that. It's that it was just
Professor Bhugra would be the perfect person to ask that question.
No, it's not a question. It was more. I don't know, have people here been sharing their experiences of how things have been for them for the past year, or not really?
Yes, we did ask for this at the beginning, Justin. So you're among friends. If you want to give your experience, we're
thank you. Yeah. Well, it was just to say I've been going to a lot of things on Zoom, which, as I'm sure a lot of people have, and sometimes I'm sort of sick of that. But at the same time, without that, things would be a lot more isolating. But what I wanted to say, particularly as someone who's a linguist, and I've been going to sort of like conscious dance things like 5 rhythms and freedom dance, but particularly classes taught in Russian from countries like Russia and Belarus, which has meant that I've been able to sort of join classes in Russian, which I wouldn't be able to go to otherwise. So that's a great thing, and very positive. But it's also meant that I've sort of like made these connections with new friends I've never actually met in person. And then, because I've got ancestry sort of going back to that part of the world, or had, so it sort of left me with this feeling of being here and being there sometimes, and also a feeling of sadness that it's, not like, for example, I'd like to go on a retreat in one of those countries and I can't because of, the fact that I'd have to isolate if I went there, which I'm not prepared to do. So yeah, that's really what I wanted to share.
Thank you. That's very interesting. Thank you. Well, I think we're almost coming to the end of our allotted time. So I'd like to suggest that we wrap up by thanking the Professor and Susham for, I must say, a very informative presentation. And I've certainly learned a lot this evening, and we're very grateful for you giving up your time this evening. Thank you so much.
Thank you.
Thank you for having us.
So, just to wrap up, then we are putting the recording online, and we still have a couple more events tomorrow and Friday. You'll find the details on the Community Association's website. Unless you want to add something, Tim?
Well, just to say that, yes, tomorrow night we have a Buddhist druid, someone who's lived in a canvas retreat center for 10 years or so has been immersed in nature for a long time. He's back living in London now, but he's going to be talking about the healing power of nature. And then on Friday, we have someone coming to talk about the social nervous system. So the autonomic nervous system and how communities thrive in safety. So that I think will speak to something to much that we've been discussing this evening actually as well. So we will hope to see you there.
Well, thank you once again for everybody that attended this evening, and again, thank you, Professor, and thank you, Susham and Dr. Poole, Thank you.
Thanks, John, for organizing this. Thank you.
Good night to everybody.
Good night.
Good night, all.